Back pain, neck pain, shoulder strap grooving, not able to do workouts that you would like to because of the size of your breasts. If this sounds like something you're dealing with on a daily basis, listen up. My name is Dr. Eric Barker, and I'm the plastic surgeon here at Peak Plastic Surgery Center who specializes in cosmetic breast and body surgery. So when talking about breast reduction surgery and the physical symptoms that it's aimed at relieving, many times with patients, they come in with neck pain, upper back pain, shoulder pain from the shoulder straps of their bras digging in, and or just overall discomfort from size and location of their breasts. When we're doing a breast reduction surgery, we aim at dealing with all of these discomforting symptoms, such as decreasing the size of the bras and weight of the breast to decrease your shoulder strap grooving, improve neck pain, improve back pain, improve posture. All of these will be addressed with a breast reduction surgery. When talking about who is a good candidate for a breast reduction surgery, it comes down to basically who's in a good health position. With breast reduction surgery, many times patients have difficulty losing weight because they can't exercise because of the pain caused by large breasts. These patients may be a candidate to have this breast reduction when they're not at their optimal weight, but they're in good overall medical shape. So again, who is a good candidate for a breast reduction? It's going to be up to the individualized patient, which I will go over during the consultation process. When deciding how much tissue to remove during a breast reduction surgery, it really comes down to the patient's goals, as well as how does the breast match the patient's overall body. So when I'm doing a breast reduction surgery, there are scales such as the Schnur scale that tell me how much I should remove. However, I will always remove enough tissue to hopefully relieve the symptoms that the patient came in with, while also obtaining a natural, beautiful, cosmetic appearing breast at the end. So when talking about losing nipple sensation or the ability to breastfeed following a breast reduction surgery, these are very important discussions to have with the patients prior to the surgery. Now, there are always risks to have decreased and or increased sensation in the nipples or breast tissues alone with a breast reduction, and you may have a decreased chance of being able to breastfeed with a breast reduction. However, these are small risks that are far outweigh the benefits of undergoing a breast reduction. Scars with a breast reduction surgery are very important to understand prior to undergoing the surgery. So typically with a breast reduction surgery, you will need a full anchor incision scar, which means you're going to have a scar around the areola, down the center of the bottom of the breast, and all the way underneath the breast. This is called the anchor incision. The reason for this, with a breast reduction, I'm not only removing a large amount of breast volume with the breast tissue, but I'm removing a lot of skin. This requires those types of scar location and position. However, the breast heals beautifully, so the scars should heal very thin, very light, and camouflage in with the surrounding tissues. A recovery after breast reduction surgery is very typical with most breast surgeries. You can expect the restrictions to last for about 6 weeks, also with activity restrictions for those 6 weeks. However, I will go over each individual week with you prior to the surgery so that you understand what's coming and when you can increase activity and when you shouldn't. Will breast tissue grow back after a breast reduction surgery, or will their breast change with future weight loss or weight gain? The answer to this is yes for both. However, you need to understand risks. The chance of breasts growing again after a breast reduction is extremely rare. There have been reports of it. It does happen, but it is a very low percentage chance of happening to each individual patient. As far as weight loss and weight gain following a breast reduction surgery, it depends on your specific body and where you gain weight. If you gain weight in your breasts prior to your breast reduction, you likely will gain weight there after. So it is very important to understand that to obtain the results and keep the results for a long time, we want you to maintain a good, healthy lifestyle with diet and exercise. So patients, when they come in and talk to me about a breast reduction or a breast lift, often have a misconception. If they're having a reduction, they will not obtain a lift. Every single breast reduction surgery involves a breast lift. So if you're having a breast reduction, you will get a component of a breast lift automatically because we need to get the tissues in the correct position. So when will my patients feel relief of neck pain, back pain following a breast reduction? It depends on the individual patients, but typically with my patients, I give them a call a day after surgery for all of my patients to check on them. And even one day after surgery, most patients say they feel some sort of relief from a discomfort they had prior. Typically, most patients will see that relief in the first 4 to 6 weeks.